Dear students, today I am going to discuss general anesthetics and local anesthetics. So this is also a very important topic of pharmacology. And let's start. What is anesthesia? And anesthesia is derived from Greek word anesthesis, which means not sensation. And if you break it in two different words like N and aesthesis, so N means without and aesthesis means sensation. So these are the drugs which produce reversible loss of sensation and consciousness, and these agents are administered by an anesthesiologist in order to induce or maintain anesthetic condition to facilitate any major or minor surgical procedure. And anesthetics temporarily block signals from your nerves at the site of procedure to the center in your brain. This is the picture. You can see general and local anesthetic. So these are two types. General anesthetic produce unconsciousness, means the receiver or the recipient is not aware of self or the surrounding environment, and sensation, analgesia and amnesia like conditions. So these are the cardinal features of general anesthesia. And immobility and muscle relaxation and abolition of somatic and autonomic reflexes. And in case of local anesthetics, so these only block in a specific part and do not affect consciousness. And let's begin with general anesthetics in brief. And general anesthetics are the drugs which produce reversible loss of sensation and consciousness, and it usually involved in a loss of memory and awareness with insensitive pain stimuli during any surgical procedure. And we use the general anesthesia for the need of unconsciousness or to maintain amnesia, hypnosis like condition, and it is used for analgesia like condition like loss of sensory and autonomic reflexes, and also used for muscle relaxation. This is the classification of general anesthetics. These are the drugs basically classified as inhalational general anesthetic and intravenous. And inhalational general anesthetics are further classified as in gas and volatile liquids. So most common example of inhalational general anesthetic is the nitrous oxide, and volatile liquids are ether, desflurane, halothane, and sevoflurane. And as intravenous general anesthetics, so we are classified as fast acting, slower acting. And fast acting intravenous general anesthetics are thiopentone sodium, propofol, methoxytone sodium, and etomidate. And as a slower acting drugs, these are further subclassified as benzodiazepines, dissociative anesthetics, opioid analgesics. So the common example of opioid analgesic is fentanyl, and ketamine is used as a dissociative anesthetic and as a benzodiazepines, diazepam, lorazepam, and midazolam. So this is the adverse drug reaction of general anesthetics. So these are classified as system and their effect and on cardiovascular system, and in case of arrhythmia, on blood pressure, on respiration, on teratogenicity. So on the triad of anesthesia, general anesthesia. So these are basically monitored during perioperative monitoring surgical procedure. So these are the analgesia, relaxation and hypnosis. Now move on the stage of general anesthesia. So these are there are 4 stages. Stage 1 is known as analgesia, and stage 2 is post delirium or stage of delirium, and stage third is surgical anesthesia, and stage 4 is medullary paralysis. So if we talk about stage 1 general anesthesia, so stage 1 general anesthesia is the stage that starts from the beginning of anesthesia administration and it lasts up to loss of consciousness. And in this stage, the patient feels like a dream-like state and reflexes, and the respiration in this stage remains same. And stage 2 is the stage of delirium, and it is also known as stage of excitatory or excitatory stage. And this stage begins from loss of consciousness to beginning of irregular respiration, and jaws are tightly closed in this stage. Heart rate and blood pressure may rise in this stage. And now move on to stage third, which is known as surgical anesthesia. And this stage extends from onset of irregular respiration to cessation of spontaneous breathing. And this has been divided in 4 planes like plane 1, 2, 3 and 4. And in plane 1, and this plane ends with eye becomes fixed in this plane, and in plane 2 loss of corneal and laryngeal reflection. In plane 3, plane 3rd, people start dilating and light reflexes, and in plane 4 dilated people and decreased muscle tone and blood pressure usually fall in this stage. And stage 4 is known as medullary paralysis, and in this stage respiratory and vasomotor control ceases, and this stage is between the respiratory arrest and death due to circulatory collapse. And now move on the administration of general anesthetics. So there are 4 stages we already discussed, and 3 phases like induction, maintenance and recovery. These 3 phases have different role. Like induction, so this phase starts from the beginning of anesthesia to stage 3rd, and the most dangerous period of induction is stage 2 because of the systemic stimulation that occurs in induction phase. And in maintenance phase, they start from the stage 3rd to completion of surgical procedure. And recovery phase, it begins from discontinuation of anesthetics to regain consciousness, movement and ability to communicate of the patient. Now move on the local anesthetics. So local anesthetics are the drugs which upon topical application or local injection can cause reversible loss of sensory perception, and especially of pain in restricted local areas. Local anesthetics reversibly block impulse conduction along nerve axons and excitable pain. And when it is used on a specific nerve pathway, or we can say nerve block, and it affects such as analgesia and paralysis like condition. Analgesia, loss of pain sensation, and paralysis, loss of muscle power. And now move on the drugs, which is classified as local anesthetics. So these are injectable anesthetics and surface anesthetics. So injectable anesthetics are further classified as low potency or short duration, intermediate potency and duration, and high potency, long duration. So low potency injectable anesthetics are cocaine, chloroquine, and intermediate lidocaine, which is also known as lidocaine and lidocaine. High potency, long duration injectable anesthetics are tetracaine, bupivacaine, lidocaine, and ropivacaine. Surface anesthetics are further classified as soluble and insoluble local anesthetics. So soluble surface anesthetics are cocaine, lidocaine, tetracaine, and proparacaine. And insoluble surface anesthetics are benzocaine, butyl aminobenzoate, oxy, and these are the complications of local anesthetics. So, complication on the behalf of local complication and systemic complication. Local complications may be needle breakage, trismus, facial nerve paralysis, maybe, and edema, fluffing of tissues, and pain or burning on injection. And systemic complications may be overdose reactions and due to local anesthetic toxicity, and it may cause vasoconstrictor toxicity and the allergy and ideal. So there is a difference between general and local anesthetics. So these are done on the behalf of prescription, site of action, area of body involved, on behalf of consciousness, on behalf of major or minor surgery, and on the behalf of poor health patient. If we talk about general anesthetics and local anesthetic difference on the behalf of site of action, so general anesthetics work on central nervous system, and local anesthetics work on peripheral nerves. And consciousness in case of general anesthetics are lost, and local anesthetics in local anesthetics is unaltered. In major surgery, general anesthetics are preferred and local anesthetics cannot be used. And in minor surgery, general anesthetics cannot be used and local anesthetics may be preferred. And poor health patient, in case of poor health patient, general anesthetics may be risky and local anesthetics are safer. And if you talk about the body area involved, so in general anesthetics, whole body, and in case of local anesthetics, restricted area